In this video, we have elaborated on two of the standard precautions, that is hand hygiene and use of PPE, which are critically important for the prevention as well as controlling the spread of COVID-19. Here is a poster by the WHO depicting 5 important situations in the clinical setting where we need to strictly adhere to hand hygiene. We are well aware of hand washing and how it should be performed in a way that it minimizes transmission of infection through our hands. This is a poster on hand rub with an alcohol-based solution when hands are not visibly soiled. Also included in this series is a demo of hand washing and hand rub by the Department of Neuromicrobiology in NIMHANS. Coming to the use of personal protective equipment or PPE, the components: face shield and goggles which protect mucous membranes of the eyes, nose, mouth. Masks, these are very important in this context as coronaviruses target the respiratory tract. So masks are important as they protect the airway from droplets or aerosols. There are 2 types of masks that are recommended for healthcare workers. The triple layer medical mask, which is disposable, fluid resistant, provides protection from infectious droplets that are emitted during coughing, sneezing, talking. The N95 respirator mask, which is designed to achieve a very close facial fit with a cup-shaped design that does not collapse against the mouth, and a higher filtration efficiency to airborne particles and a higher fluid resistance. Gloves. Nitrile gloves are preferred over latex ones as they are more resistant to chemicals, including a disinfectant like chlorine. Coveralls or gowns, both are deemed acceptable, but gown, of course, is easier to put on and remove. Shoe covers, head covers. Recommended PPE based on category of health personnel. Category 1, this mainly refers to those healthcare workers who manage COVID-positive patients or are involved in aerosol generating procedures. The risk is high and all components of PPE should be worn, and entry to these areas is for authorized personnel only. Category 2, these are healthcare workers who manage patients who are suspected to have COVID-19, may be involved in non-aerosol generating procedures in isolation wards, or those involved in the transport of COVID-suspected patients not on a ventilator, or those workers who handle human remains of COVID patients, whether suspected or confirmed, or those who handle soil linen of COVID-confirmed patients. The risk is medium, and the recommended PPE is N95 masks, gloves. Patients also may be masked as necessary, and exposure to attenders and other health workers should be minimized. Category 3, those working in the casualty, those involved in screening for COVID-2019, attenders of those suspected of having COVID-2019. The risk is considered to be low in these cases. The recommended PPE is a 3-ply mask, gloves. Minimum distance of 1 meter should be maintained, and patients may be masked if necessary. Coming to PPE donning and doffing. Before you don PPE, remember that you may have to wear it for an extended period of time. So make sure you eat, you're hydrated, and you have met any other need that you may have. Before you enter the isolation area, collect all equipment that you need. Perform hand hygiene with an alcohol-based hand rub or soap and water. Put on PPE in an order which prevents self-contamination. An example can be gown, mask, eye protection, gloves. Then enter the isolation area. And before you exit the isolation area, remove the PPE except mask, either in an ante-room or in a designated area near the door before you exit. Remove PPE keeping in mind the general principle of removing the most contaminated PPE first. An example being gloves, perform hand hygiene. Remove eye protection Gown, perform hand hygiene. Perform hand hygiene whenever ungloved hands touch contaminated PPE. After you exit the isolation area, remove the mask, discard disposable items in a closed bin, and put reusable ones in a dry closed container. PPE is ideally meant to be single-use, but in view of the shortage, reuse and how to reuse is a matter of being in line with the hospital policies. Each hospital can customize and follow its own guidelines with regard to PPE, taking care to prevent self-contamination as well as protect others from infection. When hospitals design their own PPE, its quality should be certified in terms of meeting benchmark specifications such as impermeability, fluid resistance, and other standards prescribed by the ISO, for example. We have included a video demo of N95 mask wearing and removal, and we have included video links of medical mask wearing and removal, PPE donning and doffing.